A very good afternoon to you, ladies and gentlemen of the media. Thanks for coming once again. And good afternoon to our viewers and listeners all. Today, Friday, at the end of another week, I'm here to give you a little update. I have with me my colleagues in the relevant ministries, and we have our technical people who will bring you up to date. I simply want to begin by, once again, thanking the national community for being largely cooperative and to emphasize and re-emphasize that we are still in a very fluid and dangerous situation. We are managing as best we can a challenge which we have been surprised by largely. It's only a couple of months old now, or 3 months old, and we have been called upon to watch it come to us from afar, and it's now within our borders. The Minister of Health will give you the health update with respect to how the ministry and its agencies are functioning, and the regional response, which is based here in Trinidad and Tobago and so on. And the Minister of National Security will tell you about what we have been doing in that area. I just want to mention that over and above our apparent 100% focus on this matter, it should not be forgotten that additional to this, the normal way of life has been going on. People have been going to work, people have been trying to produce, and we are still involved in local and international trade. I want once again to encourage those first responders, and I speak here specifically of our healthcare givers, those who are responsible for keeping the hospitals working, the technical staff, the support staff, the ward attendants, the maintenance people, the security people, the nurses, the doctors, and our suppliers. This is the body of people who are out there ensuring that our singular tool to respond to this challenge, our health sector, that is functioning and functioning well. And I'm very pleased to inform the national community that by and large, we have nothing but good reports from this sector. I also want to thank the members of the security services, the police service, the defense force, the customs, and all these people who are at work, keeping our borders open to allow essentials to come in, to prevent non-essentials from coming in, and also managing in a very strict way persons who come to us, and of course what happens to us in that way. And to thank all the aspects of national life which keep us having a semi-normal day while we are focusing in the most serious and conscientious way in responding at the personal level to the COVID-19 challenge. Because at the end of the day, I want to re-emphasize that the real response is personal. Personal hygiene. It is what you do. It is how you carry out the protocols. It is how you stay away from people as far as you are able to. It is how you carry out the instructions of staying home if you have to. If you are sick, then you stay away because you don't want to infect anybody. And by away, we mean in the home, outside the home. If you have to come out, as many of us have to come out, then you do what we did in the parliament this morning. We conduct our business in a slightly modified way by putting that distance between persons to minimize the transmission of the virus from one person to another. These are the things that matter. Personal behavior. Of course, there are a few persons who believe that these entreaties don't apply to them. And of course, some people go as far as to talk about their rights. Well, yesterday morning I was very sobered. I saw a television clip which really shook me in northern Italy, an area that I know fairly well, to see the Italian army going into towns to remove bodies and coffins, helping the local community because they have been overcome by the numbers. So those who think that this is a joke, have a look at that situation and imagine if that was your location, what you're dealing with. What we are doing here, as I said earlier on, we are taking some actions which are very clearly going to affect persons at the individual level or at the national level negatively. We know that. But those are the actions that we have to take. And as we take them, we try as far as we are able to cushion the effects. But we can't insulate you from those effects. And we also said that the burden will be carried by the government, acting as trustees for the resources of the population, by the business sector, by the labor movement, and by the individuals of the nation. Those four sections have to work together successfully to ensure that we have a successful outcome. We go in with this issue. We don't know when it's going to end. We may have to make changes along the way depending on what is happening. So we are monitoring this on an hourly basis. So you will see changes. And the one thing that is going to make it more difficult for us is the unnecessary and unwanted misinformation that some people seem to insist on putting in the system. But as far as we are able to, we will want to try to ensure that you get, for the population, correct and accurate information which you can trust. And those persons who believe that they can do as they please to the detriment of others, today we have gone to the Parliament and we have gone beyond the suasion and put some legal authority in the hands of our officers of state to ensure that persons at the minority level do not put the majority in any peril because of their irresponsible or miserable conduct. So we've done that, and we've had a short session of Parliament this morning, and we passed a number of amendments to existing laws to give authority to enforce certain kinds of behavior. And of course, we have to go back to the Parliament in a few days' time to give us legal authority to use some of the resources that we have available from the Stabilization Fund. So that is what we're seeing. And the Minister of Finance will talk to you about that at a later stage. But today I want to allow the Minister of Health and his staff to bring us up to date on what we've been experiencing in the last 24 hours.
Thank you very much, Prime Minister. Good afternoon, ladies and gentlemen of the media, and to all those wonderful citizens of Trinidad and Tobago listening in. I want to pick up where the Prime Minister was in thanking most sincerely all healthcare workers. I must let you know I spoke to the CEO of the Eastern RHA this morning. And do you know healthcare workers who are not in the system are actually volunteering to go and look after our citizens in Balandra? And that is to be lauded. So I want to congratulate those volunteers. Thank again all healthcare workers who are going above and beyond the call of duty. I just want to touch on a couple of things of a slightly religious nature. If there was a photograph going around of a church service, I believe in central Trinidad yesterday, if that is true, we are asking all leaders of churches, religions, you are not helping the situation. We are asking that no gathering should be more than 10 persons, because a mass gathering like that, according to the picture I saw, is a danger to Trinidad and Tobago. It's an absolute danger. I want to speak directly for a short while to the Hindu community. I've been getting lots of calls from the Hindu community about access to rivers for shaving. You know, in the Hindu religion, when you have a death in the family, you must go to a place with water and do the shaving ritual. We are encouraging people and Hindus to continue with their religious traditions. The only thing we ask is that you limit your party to 10 persons. Heaven knows we need prayer, we need to have a closer alliance with the Creator. So I just want to assure our Hindu brothers and sisters, you can go to the rivers to do your shaving, but just keep it down to 10 people, please. I will now bring you up to date on some of the operational matters that we have put into force over the past 24 to 48 hours to manage this evolving situation, this evolving pandemic of which Trinidad and Tobago is a part. With me, I have Dr. Erica Wheeler, Country Representative for PAHO, Dr. Lisa Indar, Assistant Director of CARPHA. I would have met with Dr. Wheeler and had a phone conversation with Dr. Joyce and John, who is the Executive Director of CARPHA. She's out of the country, so we spoke by phone. And Dr. Indar will be telling you what we have decided going forward with improving and increasing our testing protocols based on WHO's recommendations. But to do more testing, we are going to need people on the ground. We have operationalized within the past 24 hours the following plan to help us with contact tracing, because what is going to happen sooner or later, we are going to have community cases. So far, all the cases we have had have been imported cases, but there will come a time when you have community spread. To help us with community spread, we need bodies on the ground to do what is called contact tracing, which I think you're all familiar with now. We have now operationalized something that we envisaged. 100 persons will be going on the ground from as early as over the weekend, if need be, to help us with contact tracing. Who are these 100 trained persons? 1, 50 are coming from the Trinidad and Tobago Red Cross Society. And again, I want to thank that organization from coming forward and volunteering. The Prime Minister in 2015 would have called for people to volunteer, volunteerism. They have volunteered 50 trained contact tracers, and they will now be under the management of the Ministry of Health to help with contact tracing, because without proper contact tracing, you will get a lot of community spread. The other 50 come from a program which we launched at the Hilton. Some of you may have been there about a month ago. That is the District Health Visitor Program, where you have 50 registered nurses, already qualified, but in a special program called the District Health Visitor Program, which was something that used to happen decades ago, which we have revived. I have spoken to the University of the West Indies this morning. I want to thank Professor Brian Copeland and Dr. Ocho, who manages UWI School of Nursing, to suspend the academic part of the program and have these 50 registered nurses help us with contact tracing as early as humanly possible. So between the Trinidad Red Cross and the 50 DHVs, we are going to have 100 trained persons on the ground to help us manage this evolving situation. In line with the new protocols for testing, which Dr. Lisa Indar will speak about, is ramping up testing. Dr. Tedros would have said test, 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 but if you read his release carefully, he said test, 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 but for suspected cases, and we are going to be ramping up that. Dr. Wheeler will speak more about that. We have 4,000 tests coming into the country as a gift from the Chinese. This will come into the country.
Test kits.
Test kits, yes. 4,000 test kits as a gift from the People's Republic of China. They will be here next week for the use in Trinidad and Tobago. We are also getting an additional 15 thermal scanners to help us at our different ports of entry. Other plans we have operationalized in the past 24 to 48 hours is going to be manpower. You are going to now need more manpower. So some doctors at the North Central Regional Health Authority, Eric Williams, especially consultants, SMOs, senior medical officers, and so on, will now be attached to CUVA, because we have made CUVA the focal point for tertiary advanced care for any COVID-19 patients. Now, to do that, you are going to leave a hole or leave a gap in Eric Williams. What we have done, we are going to be hiring more of the junior doctors to work in Eric Williams under the supervision of consultants. That will free up more consultants, senior medical officers to work at Couva. So we'll be backfilling Eric Williams with more junior doctors and not so junior doctors. We have also reached out under the Office of the Deputy Permanent Secretary of Health, Ms. Brenda Jeffers, to start to reach out for retirees, doctors, nurses, any retired healthcare worker in the event that we need them. We are not waiting for the need to go that route because this is an evolving situation. Trinidad and Tobago is part of a global pandemic, and as the Prime Minister and Minister of National Security have been saying, this is evolving all the time. So we have to have plans in place, mitigation risk strategies going forward. So these are some of the plans we have operated in the past 24 to 48 hours. Just to recap, 100 bodies on the ground for contact tracing, 4,000 new test kits coming down. I met with CARPHA and PAHO this morning. They will tell you what we agreed upon as far as testing and capacity is concerned. And we are increasing our HR capacity, both at Couva and both at Eric Williams, to deal with this evolving situation and to manage the risk going forward. Thank you very much. So at this point in time, I will invite Dr. Erica Wheeler, country representative for PAHO, to bring you up to date on our talks this morning and where we are. And following that will be Dr. Lisa Indar from CARPHA, and we also have Dr. Roshan Parasram, Chief Medical Officer.
Good afternoon, Honorable Prime Minister, Minister of Health, Minister of National Security, colleagues, and members of the press. Thank you, Mr. Minister, for this opportunity to bring the population up to date on our discussions and our support to the Ministry of Health and the government. So, as the Minister said, we met this morning, and one of the key things we were talking about is expanding the diagnostic capacity of testing at the Trinidad Public Health Laboratory for COVID-19. But we're doing this in 3 dimensions. We're looking at equipment, so we will be assessing the lab machines at the 2 sites where there are machines in the country to see if they are compatible with the tests that need to be carried out. If not, PAHO will provide information on suppliers, but we will also be providing supplies for testing, 3,000 tests that would be coming next week from our headquarters in Washington as part of the scaling up of the testing capacity for Trinidad and Tobago. But beyond that, we will also be building capacity of the staff to conduct tests, because once we increase the capacity for testing, we also need to increase the capacity of the staff at the lab for testing. We will do an assessment to ensure that the infrastructure is suitable for COVID-19 testing. And there will be capacity building online. We know that even the US is shutting down, and we will not be allowing, as in keeping with the instructions of the Prime Minister, it will be difficult for non-nationals to come in. So we are being adept, and we will have coaching online, not just of the infrastructure, but also of the staff that will be carrying out the tests. In addition to this, we discussed the modeling of the possibility of increased cases. What will we do in terms of capacity at ICU, capacity in terms of human resources for health? So PAHO has tools for modeling, and we will be in a few days working flat out to assist the Ministry of Health in ensuring that we can give them data on different scenarios for any possible increases. What we want to do is to be absolutely on the spot in terms of community transmission. We don't want to be caught unawares. So between the the capacity to do more testing and also modeling the different scenarios should there be increases, we will be in a better position to help to support and advise the government. So, for example, we are looking at things like hospital readiness checklists and protocols and standard operational procedures. We will be looking at the isolation facilities in ICU. And as the minister, he already alluded to that the government is looking at the human resources for health needs. So apart from that, we are doing many other policy updates. Like, for example, the government already had an influenza preparedness plan, and we are reviewing that with the national COVID team to ensure that the international guidelines by WHO on clinical management and developing algorithms for first contact with the health services will all be in place, as well as training on donning and doffing that we have already started. So we really see this as a partnership and very much in support of the government. We have provided some PPE equipment. We will be getting more PPE equipment. We handed over some of it yesterday because, of course, the safety of health workers is paramount. So, Mr. Minister, I would like to stop there. Thank you very much for the opportunity. Thank you.
Good afternoon, Prime Minister, ministers, members of the media. CARPHA also would like to take the opportunity to thank Ministry of Health, Trinidad and Tobago for giving us this chance to speak. So, as of CARPHA has widened its capacity to test, and we are now using the new definitions from the WHO guidelines, which now indicates all samples that are meeting suspect or probable cases of COVID-19 will be tested from all CARPHA member states. So that is the first thing we would like to let you know. All samples that are meeting the definition for a suspect and a probable case. And this is in accordance with the new definitions for WHO guidelines, which speaks. A suspect case is a patient with severe acute respiratory illness, that is fever, cough, sore throat, and so on. It could be one or more than one of that, and no other etiology, or a history of being to a place where a country where there was confirmed transmission, or a patient with any acute respiratory illness and having been in contact with a confirmed or probable COVID-19 case, or a patient with severe acute respiratory infection, that is fever, and at least one of the other symptoms of respiratory illness, which is cough, shortness of breath, requiring hospitalization, and with no other etiology. So, in general, it is a person who is showing symptoms with etiology, with history of travel to a country that there was transmission, or a person who is showing symptoms and been in contact with the case, or a person who is showing any acute respiratory infection and being in contact with a confirmed case. But they must be showing symptoms. Thank you very much.
Good afternoon, Honorable Prime Minister, Honorable Ministers. Just to give the update in terms of number of cases tested to follow on Dr. Indar's presentation, we have 258 samples being sent to CARPHA. Thus far, we still have 9 confirmed positives. I want to just speak a little bit, shift the focus a little bit, and speak to the issue of sanitization that my public health inspectors have been doing. So last week, I would have advised my chief public health inspector to actually hold the hands of the supermarket owners and other people on the ground with all our public health inspectors to ensure that there was decreased risk of transmission in those places. So as you know, the supermarkets are essential and they have to remain open. Any areas where we have food being sold, the markets as well. So they would have gone out in full force to basically tell people how to wash your hands, put up hand sanitizers in the necessary areas are extremely important. Using things like gloves when you come in, disposing of the gloves when you come out are new processes that they have been using as well. And I just want to say sanitization of all hard surfaces is extremely important and has been left out in a lot of places. So it's very important. We have gotten calls from certain associations saying that the PHIs have been a little heavy-handed, telling them how many numbers of people should be in a space. I have gone back to my chief inspector, just making sure that we are not too prescriptive when it comes to public health measures. But the key is we are avoiding congregation and we are avoiding contaminated surfaces. And that's the two principles that we want to stick to. And my public health inspectors, along with the public health inspectors from the regional corporation, will be the ones on the ground ensuring that supermarkets and any other area where people congregate are clean and sanitized as often as possible. Just to give those remarks.
Thank you very much, doctors, and particularly our doctors from CAFA. Could I ask the Minister of National Security to update us now on aspects of that portfolio's involvement?
Thank you very much, Prime Minister, fellow cabinet colleagues, doctors, members of the media, wider viewing and listening public of Trinidad and Tobago. The dealing with the COVID-19, as we keep saying, is a very fluid process and one that is constantly changing. We're constantly adapting. But a number of developments continue to take place, in particular in the area of travel. I'd like to start off here today by just saying, with respect to cargo vessels that are coming to Trinidad and Tobago, the government has not banned any cargo vessels coming to Trinidad and Tobago. Cargo vessels are free to come. What we have said and the instructions that I have given are that crew members cannot disembark. When we say cargo vessels, this also includes the CARICOM jetty down in Port of Spain. So the vessels that are coming and bringing necessary food supplies, food stock that we always get, fruits, vegetables, and other things from the CARICOM, the rest of CARICOM, are being allowed to dock at the CARICOM jetty in Port of Spain at the port. And what we're doing is keeping the crews on board, and there are mechanisms and methods to then take the cargo off of the ship onto the jetty and to carry on as usual. The same applies for all of the big cargo vessels, because we were getting some calls asking for clarification on that. So it is simply that the crews cannot disembark these various cargo vessels. International airports. Citizens, international airports around the world, there are countries around the world that are taking decisions similar to Trinidad and Tobago. Fortunately, we have been at the forefront of a lot of the decisions and being proactive. What you're seeing now, we're into a stage and a phase where a lot of international airports are shutting down. Countries are taking decisions to fully close their borders. That is another step in preventing the spread of the COVID-19. So, for example, Venezuela have shut off all international travel. Argentina have done the same. I understand that even in Guyana, they have banned international flights or some international flights. This affects people because, as you've heard the Prime Minister say, in unrelated matters, we have Trinidadians everywhere. Trinidadians who have found themselves in the unfortunate situation of being in countries where they have taken decisions to close off air travel. I saw shortly before coming in here, British, United Kingdom, I think, are taking a similar decision, or at least British Airways has taken a decision not to fly any further flights to Trinidad from the 26th of this month in a few days' time. These are not situations that the government of Trinidad and Tobago can reverse, nor can we persuade sovereign countries to open up their international air travel for us. Once these countries have taken decisions to close their airspace and to shut their borders, unfortunately, there is nothing that we can do. We can reach out to the various countries through Ministry of Foreign and CARICOM Affairs, notifying them of our citizens there and asking them, as China did when this first happened in December of last year and January of this year, asking them to look out for our nationals, and we will do so. But that is as far as we can go, unfortunately. So right now, I'm getting a lot of messages from persons all over talking about family members who are in some of these countries around the world that have shut their borders. Unfortunately, there's nothing that we, the government, can do. If we have high commissions or embassies in those areas, what I will ask our nationals in those countries to do is reach out to our embassies. So at least we know you're there, and then we can make contact with whatever the local authorities are. We are globally in very difficult circumstances. But I'm putting here on record that there is nothing, unfortunately, that we, the government of Trinidad and Tobago, can do to alleviate the concerns of our nationals stuck in those situations. To continue with the point that Dr. Parasaram was emphasizing a short while ago, because we were discussing it up to late last night, with groceries, pharmacies, and businesses like this where persons need to continue going to get their supplies, the government has not said that only 10 persons are allowed to go into these establishments. What we expect is what we've been discussing, self-discipline, and that there will be social distancing. So in especially the larger groceries that can accommodate a lot more than 10 persons, we are leaving it up to people to be responsible, and in particular the grocery stores. As I said before, and I was getting messages before coming in here, they are taking their own precautions. They've set up running water to wash hands, hand sanitizers, etc. But for the public health inspectors and the other persons who may have been misinterpreting us before, we are not saying that only 10 persons can go into pharmacies. And it will, of course, depend on the square footage, how many people can safely move along. And what we're asking people, go in, do what you have to do, go out, keep your distances in those areas. The same applies for public spaces, businesses. We're being asked questions about businesses and meetings, exactly as you've seen us doing here in the past week. It is all about social distancing and your own personal hygiene. We are still getting a lot of requests in the immigration area and requests for me to exempt certain people. Persons who do not have their Trinidad and Tobago identification and have found themselves at the international airline counters around the world, I cannot persuade international airlines to put people who are claiming Trinidad citizenship onto planes. We are doing the best that we can, but as I said yesterday, a birth certificate does not automatically mean that you're a national of Trinidad and Tobago, because to get nationality and citizenship in some other countries, persons may have had to have revoked their Trinidad citizenship, Trinidad and Tobago citizenship. So it means you're no longer a citizen of Trinidad and Tobago. So the international airlines are doing the best that they can. We continue to be assessing, me along with the permanent secretaries, persons requesting exemptions. If there is one that we believe falls into the category, I consult with the Minister of Health and the Chief Medical Officer if it falls into that category. Today, what you all would have seen happening last night is the use of the Public Health Ordinance, which is a very old piece of legislation, but a very effective one, and it assists us in times like this. The current regulations that are in place, signed off by the Minister of Health after consultation with the Prime Minister and myself, are dealing with, in the immediate, a 1-month period. So we have banned the continuation of bars, meaning the congregating in bars and the opening of bars for 1 month from the 20th of March to the 20th of April. We've also said in-restaurant dining, we've also banned as well. We've banned today as well, we've added to the list cinemas, and then there was one other thing. The order is out there. I can't remember what's the fourth category, but I just want to clarify that this is for a month in the first instance, and we have now put in place this law that gives our law enforcement authorities the right to ask people not only to move along, but to charge you if necessary. Right after this press conference, I am meeting with the Trinidad and Tobago Police Service and the Defense Force, where we're going to be discussing the enforcement of this law. I'd just like to ask people, continue to be disciplined, continue to listen to the measures that the government are putting in place. We certainly don't want to have to be enforcing the law, charging people, arresting people. But if necessary, we will do so, because we need to protect the wider public of Trinidad and Tobago. So the bars, the in dining at restaurants, the cinemas, those are going to be closed, or it's also clubs, the members' clubs. So casinos fall under these members' clubs. The government is taking the decision. The Minister of Health has signed this order under the regulations that they're going to be closed for the next month from the 20th of March to the 20th of April. The only other question I was going to ask Prime Minister is the Minister of Health told us about these persons who will be going out. I know it's going to become a security concern. If we can tell the population how these 100 health personnel doing the contact tracing can be identified, because we had some mischief before. Yeah. Thank you.
So that is under the direct control, Dr. Parasram. That is Dr. Avery Hines, is it? Yes. So the 100 persons doing contact tracing will have identification. They are under the control of Dr. Avery Hines, and he will make sure that they are properly identified, so people could have faith that these are bona fide either employees of the Ministry of Health or from the Trinidad and Tobago Red Cross Society.
Okay, can I ask the Minister of Social Development to take the podium and give us a bit of an update on... Yeah, could I ask the Minister of Social Development to take the podium now and give us an update on what her ministry and her grouping are focusing on with respect to bringing some measure of relief to persons who are affected by the far-reaching decisions that we have had to take.
Thank you very kindly, Prime Minister. Prime Minister, fellow ministers, members of the media, members of the medical fraternity. I am pleased to provide the following update. May I indicate that with regard to the persons who already have food cards, and we said that we would be topping up these food cards by various amounts given the number of persons in the household, that this top-up will come in the April food card, and the entire 3-month top-up will be done at that time. So they will be topped up for 3 months in one card at that time. Could I indicate further that in terms of those households where children have been receiving meals from the school feeding program, we are in the process of working with the Ministry of Education to ensure that we have the right families listed and can make the comparison with our database. And if there are new people to be brought on board, we will be making that new set of people have the ability to avail themselves of a food card. But in the meantime, because a number of us have been getting calls, and in order to expedite the system, we are putting in place a system to start on Monday, where each of the 41 MPs will be responsible for 50 food cards that they will deliver to families with children who already get the school feeding, and the parent will be asked to sign a statutory declaration. So if they have tried to scam the government, they will be brought to justice using this statutory declaration. Each member of parliament will be getting 50 food cards in the first instance in order to ensure that we do not take too long to get these children the nutrition that they deserve. We will also be putting other checks and balances in place, but from Monday, this will take place. With regard to those persons who get public assistance and disability grant, they will get their normal check in April as usual, and those who get direct deposits will get their normal direct deposit in April. But with regard to the additions that we have indicated that they will be receiving during the month of April, but certainly before the 15th of April, they will get the 3 months additional in one separate check or in one separate deposit. So that will be from April. With regard to the persons who are referred to as the socially displaced, We have put in place an ability to provide additional financial support to the NGOs to ensure that meals are provided for lunch and dinner as a strategy to prevent those persons from roaming the streets. We'll be working with the Ministry of Health and with the various local government bodies to ensure that we institute the move along system where these persons are going to be asked to find shelter in those areas where shelter is already being provided. And as a consequence of the expected increase in numbers, we will be providing additional support to those NGOs that provide that shelter. Prime Minister, may I also take the opportunity to indicate that with regard to TNTech, TNTech has said that they will immediately stop disconnections as a result of non-payment, and this, they have indicated, will have a direct impact on customers who are most likely to be experiencing financial vulnerability at this time. Specifically, 87% of residential customers who are due for disconnection, that disconnection has been deferred. And additionally, the public utilities is putting in place measures to ensure that the increased demand for broadband services by service providers is put in place. Prime Minister, at this time, these are the updates that can be provided from the Ministry of Social Development. Thank you.
Thank you very much, Minister of Social Development and Family Services. I was trying to find a copy of the 1918 order, which I had this morning, which someone sent it to me this morning and said that the more things change, the more they remain the same. It would make interesting reading. It was very simple, very short, very to the point, and with a certain amount of definitive authority exercised by, I think, was it the mayor? The mayor of Port of Spain. Anyway, I just want to draw your attention to how things are changing. If I had spoken to any of you 2 months ago about social distancing, you would have asked me, what am I talking about? Today, social distancing is probably the most commonly used phrase across the world because we are all challenged, and the objective is that one person not pass a virus on to any other person. And the best way of doing that is to have distance between people. The experts tell us on a daily basis that if there's a 6 feet distance between two people, that should be a workable arrangement. And also that you do whatever you can away from people. We know that it is a culture shock. It is a creator of inconvenience and stress, and some people even talk about fairness and rights. But unfortunately, this is all that the population of the world can offer in response. Unfortunately, this morning I heard one of my colleagues in the parliament saying that the problem is the virus has been mutating rapidly. I don't know that that is a fact. I have heard of no authorized biologists, virologists, or experts say that. So once again, we have to be very careful with misinformation. And while I'm on that topic, I simply want to say to those citizens who find fun or believe that their objective, political or otherwise, are being met by spreading disconcerting misinformation, all you are doing is creating the potential to hurt people and making the life and the job of our healthcare givers and our officers of all ranks more difficult. And we can do without that. Thank you very much. So we are going to continue. The Minister of Finance is not here with us this afternoon because he is very busy working with his team, trying to position us for next week. We will speak to you in this way again, probably on Sunday afternoon, to bring you up to date as to what would have happened throughout the weekend in preparation for the week ahead, because we are having to face the week, not with trepidation, but with confidence that whatever is available to us, we are bringing it to bear on this challenge. So if you have any questions for the officers or for any of us up here, before you do that, I just want to mention that the Minister of Trade and Tourism would have been here with us, but I did tell you yesterday that they would have gone on to Tobago. They are in Tobago now. They would have met with the Tobago House of Assembly this morning. The Tobago House of Assembly being the executive body that has responsibility for discharging these responsibilities to the people of Tobago. So they would have gone there representing the government in its fullest and interacting with the THA executive members to tell them what we are doing and to hear from them how we can further fashion our responses and to ensure that the people of Tobago are in fact well taken care of based on the tracks that we have set for the nation of Trinidad and Tobago. And the Minister of Trade informs me that in her committee's contact with the people who provide cable services, those persons have indicated a willingness to cooperate in bringing relief to their customers, and more importantly, or equally importantly, the persons who are involved with that large number of people who are in the hire purchase business. A lot of people have obtained their items, their household items in particular, on hire purchase, which they would have obtained from our major houses, Unicoma, and their loans from Island Finance and so on. The Minister of Trade's group have been in touch with these people, and I'm pleased to inform that they are in fact cooperating in crafting and offering elements of relief. So when the Minister is available, maybe on Sunday, she will give you a bit more detail on what is happening there. So we are working all around, whole of government, and I want to say whole of country. Let it be known that Trinidad and Tobago has buckled down, and we are facing this in a sensible and responsible way. We take your questions now, and if you do have questions, we'd like to have them now.
Good afternoon, Urvashi from TV6. Maybe the Minister of Health could take this question.
Minister
of Health?
Minister of Health, yes.
So the CMO spoke of 258 cases, 9 confirmed positive. Is it that the rest were returned negative, or are we still awaiting results?
Yeah, if the technical staff can stand by there, and if it comes to you, take it at the podium there, right?
Yeah, so since the beginning, the numbers that we have as in the first column, which is number that are tested, some of them would have been pending, and some of them would have been deferred for whatever reason. Some of them would have actually been tested positive for other things, for instance, H1N1 and the like. So the number that we have in the first column is numbers that would have been sent from Trinidad Public Health Lab onwards to CARPHA. The positives are the positives, of course, that come back from CARPHA.
And as you have presented, these 9 would have been persons who traveled themselves.
All of them, yes.
So from your inference at this point in time, it would be just about, I think our first case came in on the 12th, so we're just about 8 days in.
Yeah.
Would you have expected the virus to spread to close contacts by now, if it were to?
We have to wait the full length of the incubation period. So we have to go the 14 days from first contact to second contact before we can make that decision. Someone can present anywhere from the first day to the 14th day. So we have to wait the complete duration.
Okay, but yesterday you mentioned something about a 5-day window after presenting.
That is for testing. So from the onset of symptoms, for the first 5 days, that is when you have your highest yield and the most likely chance of a true positive test coming to you, or a true negative.
I think I've been doing some reading, like everybody else in Trinidad probably, and one of the criticisms 2 countries had in particular, Italy as well as China, was that there was a delay in testing in the first few days, which would have led to the community spread. Would you have expected that this to present now? Because I know that our representative from CARPHA did mention that we're going to expand testing.
Sure.
So is it that we'll be testing even mild cases?
No,
to get a
we
true
would have
sense
tested,
of the disease?
we would have been using WHO's guidelines from the beginning, which includes the guideline that CAFA would have said. So anybody with symptoms, yesterday I went through the whole list of five groups of people that we would have been testing, and it aligns to the WHO group. I think CAFA is just going a little step further, just to make sure that member states are aware of the WHO guidelines, but we have been using that guideline from the beginning.
So it didn't change. I think, I'm not sure if Ms. Indar would have mentioned the new WHO guidelines.
Sorry. You.
Good afternoon again. So the guidelines, the definitions have been updated as from the beginning for when this started. But we wanted to clarify here that when we say we are testing all samples that are suspect or probable cases, that they must obviously face that, fit that case definition. And in all the definitions, whether you have this, WHO would have expanded their definition to clarify things more. So it's not that the definition has changed, it has been expanded so that people will understand that you must have symptoms. So that symptoms could be severe acute respiratory illness with a history of travel or acute respiratory illness with no history of travel but in contact with the case. So they expanded it to all the different possible scenarios so that people will be clearer. And what we have done is also clarified how we are testing, because I know there was a release probably a couple of weeks where we were testing 20 samples per country. So that was at that point where cases were now coming in, and we were looking at mainly the likelihood of imported cases. However, in that same release, we also spoke that if a country would have had a situation where they were doing any tracing, we would have tested. But I think, maybe that entire document was not read. So we wanted with this particular information just to say we will be testing all samples once they are suspect case, if they fit the suspect case definition.
And that is for Trinidad and Tobago or the other
This is for not just Trinidad, but for all CAFA member countries, member states, if they request it. Because there are member states that can also do their own testing.
I just want to continue with the CMO, if he doesn't mind. We have taken a lot of initiatives. The government has taken a lot of initiatives to close borders, encourage people to stay at home. However, even when Dr. Tedros was addressing the world, I think it was 2 days ago, he mentioned that there can be low transmissions, and at the end of this isolation period, there can be a resurgence. Are we looking for that? What are we looking for?
Well, every country is at different stages of the epidemic. Trinidad had its first imported case, as you said, just a few days ago. So we are the early stage of it. It came to the Caribbean region. I think we are one of the regions that the epidemic would have come to last. So we are at the early stage. We have to look at what countries would have done in the early stages of their disease and learn lessons from what happened in those places. We are learning lessons from what would have been done badly and what would have been done well in other parts of the world. And we think, of course, that we are at the early stage. So we have to wait and see. It's something that we have to take on a day-to-day, hourly basis. We're looking at the data, and we're putting all the measures in place as far as humanly possible to ensure that it does not escalate quickly, and we are flattening the epidemiological curve. That is what we are trying to do.
So for cases that would...
Mr. Wari, I'm sure your colleagues would want to have a question in, right? So if you... This sounds like it appears as though, we are doing a bit of a thesis here. I have one more question, and then I'll come to another one of your colleagues.
Dr. Rowley, Olive Gonzalez from Newsday. I would like to know, will the government give consideration to specific amendments to the law to prevent churches and other groups from having mass gatherings? Because last night, the minister said there was one issue on this, and then today in the newspaper, there's one being advertised for tonight.
I would like the Minister of National Security to read that, please. And against the background that I did say before, nothing that we are doing here is about punishing anybody. It is all about trying to save lives and to protect our population. It has nothing to do with curtailing people's rights and expectation to worship their gods. It is about saving lives and protecting our yet unidentified persons. Minister of National Security, read that order.
Thank you,
and
Prime
explain
Minister.
that
The
to me.
Prime Minister referred us to a short while ago an order that was published on the 19th of October in 1918 in the city of Kelowna, which was that was the name before Port of Spain, and I'll read it. Public notice. Notice is hereby given that in order to prevent the spread of Spanish influenza, all schools, public and private churches, theaters, moving picture halls, pool rooms, and other places of amusement and lodge meetings are to be closed until further notice. It goes on to say, all public gatherings consisting of 10 or more are prohibited. So I think that makes the
Signed
point.
by whom?
And that at the time was signed by D.W. Sutherland, the mayor.
Let me just say something to the people of Trinidad and Tobago. I, as Prime Minister, I am in charge of managing the state's response, and I am also a citizen of this country going through the same stress that every other citizen is going through. I have very close members of my family in New York, in California. I grew up with my grandparents, as you know. My grandfather told me in great detail how they experienced the Spanish flu in 1918. We in Mason Hall, we still have 3 churches on the main road in Mason Hall. On the north is the Methodist Church, where I was christened. In the middle of the village, we have the Catholic Church on the main road. And on the south side of the village, we have the Anglican Church. There are some other churches there now. But those 3 churches were there when my grandfather was a young man, a very young man. And in 1918, he told me that there were days in the village where every afternoon at each church in that little village, there were 3 to 6 or 7 coffins for funerals in the afternoon. Going to funerals had become a ritual in 1918, 1919, in what they called an epidemic year. That is what some of our citizens faced in this territory. Let us not take this thing as a joke. Nobody is preventing anybody from communicating with God. I think it is possible, even in the teachings of the Bible, to communicate with God without going to church. That's my understanding of it. But if in going and gathering, you're risking your life and the rest of lives in this country, please be sensible. That's all we're saying.
To the advice by the government, would the government be forced to force these people to gather in 10 or less?
The law provides for interventions. We have deliberately started out on this process by speaking to the population and relying on the good sense of the vast majority of people in this country. We knew that there'd be a minority that would not understand or cooperate. And as leader of the government, I did say that we do have a heavy hand and we will use it if we have to. Today we passed legislation to allow our services to intervene in gatherings if we have to. Because at the end of the day, we are not going to lose sight of the objective. Do not congregate. It is when you congregate that you give the virus the opportunity to propagate and put all of us at risk. So please, let us not lose sight of the objective. It would be a real pity if we would have done so well and our health caregivers are doing so well. And instead of getting the benefit of that, there are people who will be irresponsible, do exactly what we don't expect to do, or spread information that create hurt where hurt is not to be countenanced. So those are two categories of people who all of us want to appeal to them. One, those who want to congregate because they think they have to, and two, those who figure they have to spread fake news. Those two groups of people, you are operating to the detriment of the people of Trinidad and Tobago. And on behalf of the children who can't speak for themselves, on behalf of the elderly who are most vulnerable and exposed to your irresponsibility, on behalf of the healthy who are cooperating and can only do what they can do at their personal level, I'm once again appealing to all our citizens to do what has to be done. We are a small community, 1.4 million people. We are on an island. We have the possibility, the chance, because of who we are. Small number, 1.4 million. You know, 2 islands, or where we, or 2 or 3 or 4 islands, if we occupy them all in that way. If we conduct ourselves carrying out the protocols that our health experts tell us to carry out. We're not playing doctors here. We're not playing experts here. We are following the instructions given to us by our trained personnel. If we do that, we have a chance of minimizing our exposure and the deleterious effects of this virus on us. If we don't do that, we could go the way of all others, many of whom are suffering now because they do not have our initial strengths and they do not have the protection that our island nation offered us in the beginning, which we can spoil by our behavior. So let us see if we can get the best of what we have to start with.
I have a question for the Minister of Health.
Minister of Health, yes.
Which other countries are using our model for dealing with virus? Is it that we are using an already established model?
No. When we started off this in January 2019, I said specifically we are going to manage this situation by setting up a parallel healthcare system to deal specifically with COVID. Because you have to learn from other countries that are treating COVID-19 patients in their existing infrastructure. Take Italy, for example. It has broken down completely. A woman who is pregnant today in Italy cannot access a hospital bed to give birth. So we have to learn from that. And that's why I said from the very beginning, in setting up this parallel healthcare system, we will use Cora and CUVA, and if need be, the new facility open in St. James, and the new facility we are going to open in a couple of weeks in Costard Building in Port of Spain to provide secondary care and tertiary care so that the rest of the healthcare system goes on unaffected. That is a model. And others are looking at it to implement. It has worked well, and we are willing to share it.
But there's one thing we want to say, because I know we'll be meeting like this very frequently in the weeks ahead. And I don't want anybody to misrepresent what we are saying or what we are doing. The nature of this problem, it is quite possible that next week or 2 weeks from now, we could be dealing with different numbers yeah. Scarier numbers here. And it doesn't mean that it has collapsed. We want it to mean that we can still manage it because we have the structure in place to manage it. The real calamity that we have to stave off is not to find ourselves in a situation where the level of infection overcomes the healthcare delivery system. That's what we have to stave off at all costs. And as we do things to allow us not to be in that situation, the economic fallout we are trying to deal with on the other hand, and that is what the Minister of Finance and that is what our financial resources are being put to allow us to walk the road. We still have a long road to walk. I saw somebody saying in the American system yesterday morning, a very good analogy. It's a marathon. She said we are on mile 1. And if we are in this situation in mile 1, where are we likely to be on mile 24? And I thought that was a good way of putting it. It's a journey that we are on. As long as this virus is around, we are on that journey. And we have to ensure that at no point in that journey we are unable to go put one foot in front of the other and go forward. We have done things, we are continuing to do things, we'll continue to do things to make sure that our health caregivers are kept healthy, kept safe, be available to the rest of the population, and that the hospital infrastructure, the physical infrastructure, the supply system, they're all there to keep us in a position to respond, because we will be called upon to respond. Yes?
Hi, Rosalie from CNC3, Minister of Health. My first question would be the 9 confirmed cases. Without revealing too much about them, how are they doing, as well as the 68 persons in Balandra?
Please don't ask the minister to do it. I tell the minister is not a doctor.
Chief Medical Officer.
I know. I have to.
Without saying too much, basically they all 9 cases are still within the hospital system. Some in Cora, some in Cuba, but they are the more severe ones are showing improvement day to day. The milder ones are doing well.
Good. Very good.
Sorry, in Balandra, they would have come in recently, so we would have had a few people developing mild symptoms. Of course, as we said, once you have symptoms, we will test. But other than that, mild symptoms meaning sore throat, some runny nose, that kind of thing, very mild symptoms. But once we have symptoms, as I said, we will test as many people as we can. Of course, if they become positive, we will transfer to one of the centers, either Cuba or Cora.
Lady in the black, young lady, you still have a question?
I was wondering whether there was an update on Mrs. Prasad Bissasa's meeting with you, whether it happened at all, did anything constructive come of it?
We had a conversation, yes, and the opposition, what really happened, the meeting was a meeting of 6 colleagues of the parliament. I met the opposition leader and 2 of her colleagues who happened to be medical doctors, and I had with me Minister of Social Development, Minister Robinson Regis, and Minister Young, National Security Minister, and Minister in the Office of the Prime Minister, and we had a conversation. It was a very useful conversation. The opposition brought a printed list of what they thought the government should be considering, and they made certain suggestions. I'm pleased to say most of what they focused on are exactly what the government has been focusing on, and we therefore have see eye to eye on those things. Much of it you would have heard here today about testing, what is CARFA doing, preparations in terms of having ventilators available, the use of additional staffing. I'm sure you would have got the printed list, but you would see when you see it. And I simply want to say that the advice that we would have got in that conversation from those 2 parliamentarians who are doctors, the government has available to the government in the healthcare system, which I've been repeating over and over, that we are relying on a body of doctors of all specialities who have been providing the state with their expertise. And the government has been listening to them, the government has been guided by them, and the government will continue so to do. So it was not anything out of the ordinary to hear from 2 doctors who are parliamentarians, because God knows we have been listening to doctors for the last 3 months, and we'll continue so to do. But I'm pleased to report to you that much of what those parliamentarian doctors were saying to us this morning are in step with what the other doctors have been saying, and the government's response is what we have been doing based on what the technical people have been saying to us. And the other thing is the use of resources to cushion and ameliorate the negative effects of the decisions we are taking, which is exactly what we've been saying to you, except that we have to understand, and I said so to Mrs. Prasad Bisasa, as a former Prime Minister, and our 3 colleagues there, you must understand that there's a limit to what the government can do in terms of providing financial support and financial interventions. The Minister of Finance committed a $6 billion program here on this response program in more ways than one. And so we were on the same page. The government has to find resources, and we found as much as we could. $6 billion is what we had not catered for 3 months ago. But we have to cater for it and use it now, focusing on those people who are least able to look after themselves. So I think we're on the same wavelength, and the conversation was very useful, and I dare say very civil. And we did ask the opposition leader, who did indicate that she had instructed that persons not engage in misinformation and fake news. And we did ask her to continue to do that, because that would help.
So Mr. Dayal Singh, I'm just wondering if we have an update on the hotlines that I know you've been moving on.
So the hotline is up, and we are testing it in-house with a select group of ministry employees and some members of the public to make sure we work out all the gaps, all the kinks. We have hired 10 doctors to man it. However, we are seeking to improve it with the help of TSTT. In addition to that, we are going to layer that hotline now with an app. Someone donated a COVID-19 app, absolutely free of charge to us. What that app will do will give you on your screen a list of questions to answer, some boxes to check, so that you may not have to speak to a person. What that will do, all the hotlines all around the world have collapsed under the sheer volume of calls. My daughter works in England, so I know. So we'll be launching the hotline next week. It's being tested now in-house and with some members of the public to work out the kinks. And we also want to do the app.
Yes, sir.
More ministers.
I didn't hear you.
I said Prime Minister or ministers. Good afternoon. Angelo Marcel, Newsday.
Newsday.
Right.
Please.
I visited a couple senior citizens' homes and differently able institutions, and they seem to be really ready for what is going on. That is one sector of of those people, citizens. But I've noticed that the street dwellers are not really being addressed. They're all over the place, they're touching stuff, they're mingling, they're living in drains. What is really being done about that sector?
The Minister of Social and Family Services could probably respond to how we're approaching that.
Thank you very much for that question. And thank you for recognizing that the elderly and the disabled are well aware, because the ministry has been sending out guidelines to them. With regard to the street dwellers, as you call them, we have indicated on more than one occasion that there is a court decision, a judgment, that says it is within their human rights to be allowed to stay on the streets. First of all, that's the position in which we find ourselves. What we have done, though, is we have engaged the mayors and chairmen to indicate that what we would like them to do is put in place a move-along policy, which is that they use the police officers within their remit, which is not their first responsibility, but at least using these social development staff to get these people to move along and go into the shelters where we do provide assistance for them, and through the Ministry of Health, we'll also be able to assess them, because at least 30% of them have mental health problems. But we are constrained by the judgment, and we are hoping that during this period they will move along and go to those homes and shelters that are available. Sorry, and we have, as I said a short while ago, put in place a system where we'll be able to provide financial assistance to ensure that once they do go there, meals will be provided for them.
to, but I'm wondering what is... Yes, I'm wondering what is WASA's role in this? The Minister of Social Development would have spoken about TNTech and other utilities, but we have received complaints in our newsroom about people not having a water supply at this time where they're being asked to wash their hands and keep their surroundings clean.
Let me answer that. That's one of the points. That's one of the points raised. Yeah, that's one of the points raised by the opposition leader this morning. Even before we had a COVID-19 problem, we do acknowledge that there are areas in the country where the water supply is not as it should be, and in some communities it is way below where we expect it to be. The Minister of Public Utilities is working with WASA to ensure that in those areas where the water supply is at its worst, that efforts are made to ensure that all persons have a basic supply of water. But this is not a COVID-19 problem. This is a pre-COVID problem where we've had these pockets of people here and there where there's a very bad water supply, and there are other areas where the water supply is intermittent. And now we're in the middle of the dry season. You know, we're still on the water watch utilization. So this is something that the responsibility of the agency, WASA, and the local government bodies should be able to respond. Local government bodies, some of them have been saying that they have not been able to provide chalk-borne water because they have not had financial wherewithal to do that. Now, I find that a little difficult, so I spoke to the, and will keep speaking to the Minister of Local Government to instruct these people who are saying that to use monies that they have in their accounts to try and save lives. Last week, a question came up in the Parliament, and I was surprised as Prime Minister, given what I'm being told on a regular basis about no money to provide water for people in local government districts, that local government districts across Trinidad and Tobago, Trinidad in fact, had what, was it 60 or $70 million in their accounts of what you call unspent balances, meaning that monies that were approved for them to spend on or whatever, and they didn't get the work done or the expenditure done by the end of the fiscal year, they are allowed to keep that money, and it's called an unspent balance. But to use it, they need to simply ask the minister for approval. And this is about $60 million of money in corporations, and the leaders of those corporations, in fact, one of the corporations that bleat the most about that, had $17 million in an account called unspent balance. And if I go a little further, they know when to ask for unspent balance to do foolishness, but they don't know when to ask for unspent balance from the minister to get water for people. But they run to you in the media to try to make the government look bad by saying that they don't have water to wash their hands. Come on. If you have money in your account, unspent balance, getting the permission from the minister, because the minister has been instructed and is authorized to give permission to spend that money for anything. And it usually is spent on a development program item. We can spend it now on saving lives by washing hands. So I expect that that would not be putting us in a situation where people have no water, because we do have some resources in local government that could be directed for that purpose. And in the meantime, WASA and TNTech at the management level will take administrative decisions not to disconnect people from the supplies of water and electricity during this period. Vashi has another question.
A few days ago, Dr. Trotman, she would have told us that, this COVID virus, it affects mostly elderly persons and those who are immunocompromised. Given that young people we see, not just locally but internationally, have been shrugging off these warnings, are you going to revise that, that advice, all persons at risk?
Okay. So first of all, I think the Prime Minister will be glad to know I haven't touched my face once for the entire press conference. I get buffed for that. Anyhow, to answer your question, Ravashi, the epidemiology of that is changing. What you are seeing around the world, and the doctors here could confirm, is that more and more young people now in their 20s and 30s are coming down with it. That shows that young people are not as immune as they once thought they were. And we always said from the beginning, even though young people may not display severe symptoms, they will take it home to their parents, to their grandparents, and literally kill off their grandparents. So the advice is, as the Prime Minister has been saying, all of us are in this together. Everyone, young, old, child, everyone has to come on board with the leadership of the government for social distancing, washing of hands, cough etiquette, and don't congregate. Don't give the virus a chance to jump from person to person, because that is what will give you community spread and overwhelm your healthcare system. So the message to young people is simply behave.
Those that are at home in a home setting, you might have overcrowding there as well. Do you have any advice for persons? You don't just stay home and congregate. What do you do in terms of bathroom settings, different types of etiquette? I don't know. Sometimes we say you take somebody tutor, eat from the same plate.
Yeah. All of those things to me need to be revisited by households. There's a old saying, cleanliness is next to godliness. Now is the time to live that adage, that we need to be clean. Our surroundings need to be clean. Don't share, if you have a child, you drink from the same cup as your child. You give your child your cup to drink from, as you say, juta. We need to get past those things now. And if we take the simple, common sense measures at home, we will get through this. We will come much stronger.
I think we've had a long session this afternoon. I just want to say to the national population, particularly those of you who work in media, to get a full appreciation for what we are facing, what we have been doing, and to probably compare where we at with others. You simply need to follow what is going on outside of Trinidad and Tobago. I understand that one of our Caribbean islands have just reported a significant increase in confirmed cases, which is a good distance away from where you were 2 weeks ago with 0. There are countries that are completely locked down, shut off, and cut off from the rest of the world temporarily. You would see a situation like, an airline like Lufthansa. Lufthansa has 763 planes. They have grounded 700 of those planes. And the week before, Delta grounded 300 planes. But of course, we are responding to these developments. Amazon is employing 100,000 people today to become couriers to carry food for people, because you can no longer go out to restaurants. Maybe in Trinidad and Tobago, we'll move from running down to the restaurants on the Arpita Avenue to some kind of courier services. Fortunately, we have some good technical possibilities. You can call up on your phone, you can follow on your phone. But this thing is going to change lives. It is changing lives. And we don't know where we're going to end up when it is all over. But in the meantime, we are part of a much larger gear that is spinning, hopefully not spinning out of control. So thank you all very much for the job that you're doing in informing the public, and we'll continue to provide you with all the information that we have available to us, and we will continue to be our brother's keepers. Thank you very much. The Minister of National Security wants to address something that didn't come up.
Thank you. It's based on the point that we made earlier, and I tried to emphasize it. There are international airports and sovereign countries taking decisions to close down, exactly as the Prime Minister just alluded to. There is nothing that the government of Trinidad and Tobago can do. For example, Venezuela has decided to shut its borders and to close down, and airlines are not being allowed to fly in. I am being bombarded here on my phone now by some members of the media saying that there's 70 Trinidadians in Margarita, saying that the government has abandoned them. I am emphasizing there is nothing that the government can do in those circumstances, unfortunately. It is a live situation. It continues to evolve. We will do as much as we can, but within the parameters of sovereign countries taking decisions to close their borders. So unfortunately, persons who are stuck in countries where there are no international flights in or out anymore, there's nothing that we can do.
Will you all see the invitations, the reduction in fares and invitations for cruises.
How much?
Have a good day, right?